If you go back in time, I believe that the ACA, especially as it allowed us to expand Medicaid, was especially helpful to rural America. There's just a larger percentage in at least our rural areas of folks covered by Medicaid. About half of Kentucky's kids are covered. About 70% of our long-term care costs for our seniors are covered. And so what that allowed us to do was to keep rural hospitals open when a lot of states that did not expand Medicaid saw them close. But now what we see under this Trump administration is the biggest threat to rural health care in my lifetime. What I call the big ugly bill, he calls it something else, is going to potentially shutter or at least significantly hurt 35 rural hospitals in my state. It could result in 20,000 healthcare workers losing their jobs. Coverage for 200,000 Kentuckians are on the line, and that's just the cuts in that bill. When you amplify that by a Congress that was willing to vote yes to extend a tax cut for the wealthy, but vote no to extend a tax credit for health care for working Americans, it's a double hit to rural health care. Because if people roll off that insurance offered on the state health care exchanges, that's even fewer dollars going to those same rural hospitals because those private insurance plans pay more, are helpful to those hospitals. So when you see both of those sources drying up, what we're going to see across rural America is fewer options, people having to drive hours just to give birth, just a real difficult challenge that our American families are going to bear the brunt of. And if these hospitals close, it's not just the hospital closing. It'll be the local restaurant, the local coffee shop, possibly the local bank or insurance agency, because again, so much of the economy of these communities goes through that rural hospital.